One day, as you're driving to work, the unimaginable happens. You've been involved in a serious accident, and you're badly injured. At this point, it's the job of emergency medical services to do everything possible to keep you alive. The tools at their disposal may very well be the deciding factor in if you survive or not. One very common concern for trauma patients in motor vehicle collisions is hypovolemic shock caused by excessive bleeding. In hospital, definitive care for hypovolemic shock includes giving whole blood to raise perfusion throughout the body. However, in the pre-hospital setting, whole blood is generally not an option. Generally in the United States of America, there are very few options given to emergency medical responders to treat hypovolemic shock or poor perfusion. Currently, the Kentucky Board of EMS protocols in my own state only allow emergency responders to give IV fluids such as lactated ringers, normal saline, or dextrose in water for pre-hospital shock and trauma patients. Unfortunately for patients across the United States, current medical evidence does not point towards IV fluids being effective at reducing mortality or helping people who are in traumatic and hypovolemic traumatic situations. The efficacy of pre-hospital IV fluid management in severely injured adult trauma patients, a systemic review and meta-analysis in 2023 from researchers at the Northern Ontario School of Medicine in Sudbury, Ontario, reviewed all available documentation from 5 different medical databases and found absolutely no improvement or difference in the survival rate of patients given IV fluids during hypotensive trauma versus patients who were not given fluid. And again, another comprehensive study, Influence of Pre-Hospital Fluid Resuscitation on Patients with Multiple Injuries and Hemorrhagic Shock in Patients from the DGU Trauma Registry, performed by the Department of Trauma Surgery at the University of Hospital Essen in Germany, assessed over 35,000 patients treated in the German trauma system and actually found a strong correlation between providing large amounts of IV fluids to trauma patients and causing excessive bleeding, multiple organ failure, and sepsis infection, indicating that using IV fluids as replacement for lost blood is actually harmful to patients, not helpful. There is hope for a better alternative, however. While whole blood products remain expensive, dangerous, and difficult to give in the pre-hospital setting, human blood plasma has always been an effective option for trauma patients, and with recent scientific developments, it's now available in a form perfectly suited to the EMS environment. Last February, Octapharma AG, a European pharmaceutical manufacturer, received regulatory approval to market lyophilized or dry powderized human blood plasma for the emergency trauma setting. This dried plasma powder still contains all of the essential components of human blood plasma, such as fibrinogen, proteins, clotting factors, and immune factors, but can be safely stored at room temperature for up to 2 years. To infuse the plasma, a provider simply mixes the powder with sterile water to reconstitute, and it is immediately ready to use for up to 8 hours after mixing. Research resoundingly shows that infusion with plasma is an extremely effective, completely safe, and easily performed procedure that reduces mortality, reduces the amount of whole blood needed, reduces inflammation, and again improves patient outcomes. A systemic review of available studies performed in 2019 by the University of Texas Health Center and Washington University School of Medicine, St. Louis, Missouri, reviews dozens of studies and clinical trials that showcase the safety and efficacy of blood plasma, including in its lyophilized form. The researchers at University of Texas and University School of Medicine, Missouri, point out that multiple studies show that LP is safe and effective. They found that dried plasma performs similarly in clinical trials to fresh frozen plasma, and both had a similarly positive impact on patients that received it. In 2013, lyophilized plasma was adopted by the Israeli military for combat medical use. A retrospective study of that Israeli military found that 109 patients between 2013 and 2016 were treated, and that there were only 5 cases of difficulty reconstituting the powder. Only 1 patient reported mild side effects. The Israeli military assessed dried plasma as overall effective and safe for resuscitation of trauma casualties. Further studies show that in patients with intracranial hemorrhage, early infusion with plasma increases survival. These same studies showed plasma as superior to crystalloid solutions and leading to faster recovery. Studies of emergency department patients found reduced mortality and reduced need for blood transfusion in patients given plasma. Plasma is suspected to play a modulating role not just in controlling bleeding and coagulation, but also in preventing and modulating damage to endothelial tissues. In studies on pigs, both lyophilized and fresh plasma were effective at reducing brain lesions and swelling during intracranial hemorrhage by 50% and 54% respectively. In another study on pigs, fresh plasma, lyophilized plasma, and whole blood were all equally effective at correcting traumatic coagulopathy and excessive bleeding, with 0% mortality rates. Crystalloid solutions were ineffective and led to 85% mortality rates. A U.S. Department of Defense trial of plasma showed that patients who received plasma early had significantly reduced mortality, quicker hemostasis, and reduced death to excessive bleeding. Another animal study showed that compared to colloid IV solutions, 7-day survival was equivalent with spray-dried plasma in animals that received whole blood. Lyophilized plasma was adopted by the Norwegian Air Ambulance Service and by the Swedish Armed Forces, respectively. The Norwegians treated 16 patients without complications, and the Swedish Army successfully reconstituted the dried plasma and treated a patient inside of a Black Hawk helicopter during a transport. These studies repeatedly show that dried plasma is easily used, safe to use, and highly effective, and in cases of excessive bleeding, as effective as whole blood at stopping that bleeding. Evidence repeatedly points to plasma being superior to IV fluids such as crystalloids and colloids for treating trauma patients. The effectiveness of plasma for trauma patients is further proven by a comprehensive set of clinical research in the New England Journal of Medicine, Prehospital Plasma During Air Medical Transport in Trauma Patients at Risk for Hemorrhagic Shock from 2018. The study found evidence that early administration of plasma in the pre-hospital environment may reduce the risk of bleeding and shock. In a group of 501 patients, mortality was significantly lower in the patients who received plasma. In patients with shock caused by bleeding, mortality was significantly lower when plasma was used. The researchers advised to minimize coagulopathy by treating with blood products like plasma and minimizing crystalloid IV solutions. The study finds strong evidence that plasma transfusion reduces coagulopathy and bleeding, reduces the permeability of endothelial cells, and alters the inflammatory response. Patients who received plasma had a reduced 30-day mortality of 9.8%, with 76.8% of patients surviving instead of only 67% without plasma. Patients who received plasma had significantly higher survival of the first 24 hours and required less blood transfusions to survive. Of all of the patients who received plasma, only 2.2% had a reaction, all of which were assessed as minor and were easily resolved. Again and again, medical evidence points towards plasma increasing survivability and being much more effective than using IV fluids. In summary of all of this, across the USA, EMS protocols frequently only indicate to use IV fluids, such as crystalloids and colloids, in shock and trauma calls. Current evidence suggests that IV fluids are ineffective and have little effect, or worse, a harmful effect on patient outcomes. Recent science has made blood plasma shelf-stable, easily reconstituted, and administered in the pre-hospital setting. Evidence strongly suggests that plasma infusion reduces bleeding, reduces mortality, reduces tissue damage, and saves lives. In some cases, plasma is as effective as whole blood. When you or your loved one are injured, which would you rather be given?